November's Lung Cancer Awareness Month, a time to remind everyone of the dangers of smoking, but also to break through stigma around that disease.
Riley Nagel spoke with a local lung surgeon and a lung cancer survivor who say more factors contribute to the disease than just smoking. He has the story.
It's not so much about tobacco, it's if you have lungs, particularly if you have a family risk of cancer, a genetic risk, you can get lung cancer.
Dr. Rob Hedrick is the chief thoracic surgeon for CHI Memorial. Hedrick says more people die from lung cancer than all other forms of cancer combined.
We've got one person every 2 hours dying of the disease. And if you look at the 95 counties in Tennessee, you have a 50% chance of dying from either a heart attack or lung cancer.
Hedrick says culturally it's common for people to smoke in the South, which of course negatively affects your health, but he says many of his cancer patients aren't even smokers.
And they're very shocked by it because their answer is, well, I never smoked. Of course they didn't, but they have the genetic defect that's driving it.
He says a common misconception is if you get lung cancer, it means you did it to yourself. Sadly, Hedrick says many people diagnosed keep it to themselves, feeling shame and guilt. To help normalize the conversation, Hedrick wears colored socks covered in white ribbons, hoping people will ask him about them. He tells them the importance of getting scanned as early as the age of 50.
Have a family history of cancer, have had a smoking history, then you need to be getting a yearly CT scan. That's the simplest screening test in the world.
Patrick Markram recently beat cancer in August. He believes that had he not started getting yearly scans in 2018, his cancer would have grown undetected and likely would have killed him.
And I'm back walking 5-6 miles a day, playing golf 4 days a week, doing whatever I want to do.
Hedrick hopes the awareness raised in November will help break down the stigma around lung cancer, empowering people to get scanned before it's too late.
We want to see much more survivors from this disease in the future, and we want to see a healthier Chattanooga, and this is the best way to do it.
Reporting in Chattanooga, I'm Riley Nagel, Local 3 News.